Welcome to 2018 at ecancer. I'm Gordon McVie and the founding editor. Hope we have a wonderful year and just as good a year, if not better than last year. We ended last year with two good meetings, which we've covered with our usual very fast expert interviews, and they're from ASH and from the San Antonio Breast Cancer. And as usual, there's some really good headlines coming out of both of those. And we start the year with two modules on which we've been working for several months. One on neutropenia and how the management of neutropenia, big problem in cancer patients who are immunosuppressed and who get nasty radiation and drugs to further suppress the bone marrow. So one's on management, 2018 management of neutropenia, and the other one is a very topical coverage of the best practice in tobacco cessation. This has been done by Anne McNeil, who's the Professor of Tobacco Addiction at King's College London. And it really is state-of-the-art today. It covers all the European guidelines and all the global guidelines which have been published, and adds on more peer-reviewed evidence of what works in tobacco cessation and what is still not proven. And then still on the epidemiology front and prevention, there's a very beautiful systematic review from also King's College London, Mika van Hemmerich, together with Uppsala and with Karolinska in Stockholm. And this is looking at the interaction between diabetes and cancer, and particularly prostate cancer. The interactions were spiked by an observation of metformin having a possible cancer prevention role. But the links are far, far deeper than that. The more people have looked into the mechanism of this interaction, the more exciting it's been. So a systematic review from Mika van Hemmerich's group. Our first special issue to launch 2018 is on the surgical management of breast cancer. There's stacks of stuff in ecancer on the hormonal management, the immuno-oncological management, CDK4/6, radiation techniques, etc. But this is a review on the surgical approach and what's new and what's going on there. It's been edited by Michael Dueck, also from King's College London. That's 3 contributions in 1 month from one university. And the topics are failure to protect the breast cancer in a patient with a localized cancer by giving widespread radiation and the consequences in terms of side effects. So partial radiotherapy is important, but what's important is how the surgeons can cut down the need for any radiation therapy if possible in an ideal case. So clearly sentinel nodes and how you detect them is revisited. The ways of delineating more exactly what the margins of breast cancer are surgically with the help of isotopes or not, and then how the best form of surgical treatment should be fitted to that situation. The HIFU is coming into its own. That's high intensity focused ultrasound, and there's an interesting article on that. And then there's the question of whether partial radiotherapy could be just as successful in localized breast cancer as widespread conventional radiation therapy, which we know is toxic. Then there's the issue of patients who've got multiple focal cancers in the breast, and also those who've got a genetic predisposition, be it BRCA1 or BRCA2 or other things. So for patients who've got multiple focal breast cancers and who've got 1 or 2 cancers or even one cancer with BRCA1 mutation, BRCA2 mutation, in other words a genetic predisposition, this special issue recommends mastectomy, and it's quite clear, and there are no other advances in surgical technology to beat mastectomy in this situation. I don't like long overviews of the month's activity, but this has been a particularly active month, end of December over into January, and there are 5 articles, and I can't honestly comment on them, but bring them to your attention because they're all good. First of all, there's fertility, preservation and gynaecancers from Francesca De Felici. Endometriosis and endometriosis-associated cancers, new insights on how ovarian cancer might develop in endometriosis, and that's from Dawson. And then in Latin America, we've got a mortality-incidence ratio being tested out in the Lima population of cancer patients as an indicator of 5-year cancer survival, and that's Caroline Stenning-Percivale. Over to Africa, natural history of castration-resistant prostate cancer in sub-Saharan Africa. It's a single centre study in Nigeria from O. Bello. And lastly, something we should be attentive to, we should always be attentive when our chief blogger brings something to our notice, and that's Bishal Giyawali, if you haven't already read. And he's asking the question, does the oncology community have a rejection bias when it comes to repurposed drugs? In other words, if they're not conventional immuno-oncology drugs, flavour of the moment, or cytotoxic drugs or hormones, if they're repurposed drugs, let's go back to metformin, the first thing we mentioned, supposed to be used just for diabetes. Has it got a role in oncology? Is there a bias amongst us against repurposed drugs? So read Vishal's article and find out for yourself. I'll speak to you next month.